There's trouble with my internet because everybody's voice keeps crackling for me.
Okay, we are live.
Good evening, everybody. Good evening, everybody. A warm welcome to yet another episode of Diabetes Bytes, where
Yeah, Dhruvi, go.
Namaste. Good evening, everybody. Good evening, everybody who's logged in to our yet another episode of RSSDI Diabetes Bytes. We are doing a very innovative episode today wherein we are requesting everyone present here to make this episode very interactive through an exclusive question and answer with our expert over here, Dr. Neeta Deshpande, ma'am. Neeta ma'am is one of our experts, a stalwart in the field of obesity and type 2 diabetes. She's a consultant endocrinologist and physician from the city of Belgaum. She has multiple accolades to her name, and I think the whole episode will go if I keep reciting all of them. But I'll request everybody logged in here to take this opportunity to interact with our expert, Dr. Neeta Deshpande, ma'am, today. So, with the opening, allow me, ma'am, to ask you the first question of today's evening and today's episode. Ma'am, why are we talking about obesity? Why are we talking about taking care of people with obesity?
Yeah. Thank you so much, Dhruvi, and thanks for your kind introduction. And today we are here to talk about a burning issue that doesn't seem to be going to recede anytime soon. The reason we are talking about obesity in such a big way today is that one, obesity is increasing exponentially in our country, more in the urban, a little less in the rural. Secondly, we're talking about obesity because we know today that obesity is the mother of all diseases, which means to say that because of obesity, one can get so many other diseases, which we will tackle a little later, perhaps with some more questions. And we want to reduce the cost of treatment, health treatment in the future. One has to lose weight. We want a better quality of life for our people. People have to lose weight, and that's the reason we are talking about obesity. And lastly, the environment today that is there is not at all conducive to a healthy lifestyle. There is a lot of junk food, there is lack of activity, too much of gadgets, too much mechanization, because of which obesity is just increasing. And that's the reason that we need to start talking about obesity and making people aware of it.
Amazing. Thank you, ma'am. Thank you so much for the wonderful answer. And it is indeed a very serious problem. I will here again take this chance to request everybody present here, logged in here today to our RSSDI Diabetes Bytes, to please post up all your questions in the chat box. And our expert is here to answer all of them. So again, to continue our discussion, Neeta ma'am, um, how do we define obesity, or how, if I want to identify myself as an obese person, what should be my signs and symptoms, and how should I identify or say that I'm obese?
Right. So, obesity is something that is seen, unlike diabetes or hypertension. अभी अब किसी को अगर डायबिटीज है या ब्लड प्रेशर है तो वो दिखता नहीं है. आपको टेस्ट करना है, बीपी आपका मापना है, तो ही आपको पता चलता है कि यू हैव डायबिटीज और ब्लड प्रेशर. बट ओबेसिटी ऐसी चीज है कि मोटापन दिखता है, बट still we need to define it. Matlab, we need to know what are the cutoff points for calling a person obese. So the commonest thing that is used is the height for weight ratio, which is called the body mass index, which is the BMI. अगर BMI 23 से ज़्यादा हो और 25 से कम, मतलब 23 से 25 अगर आपका BMI आता है, तो we consider the person as overweight. 25 के ऊपर we call the person obese. Now this is only based on the person's weight. However, in India and in many other Asia Pacific countries, we have something called uh, obesity, which is hidden, or we call it central obesity. Weight may be normal, or weight may be just a little overweight, but all the fat may be concentrated around the waist, and that is called central obesity. And this fat is also deposited in the organs like the liver, and that is called central obesity. सो ज़्यादातर लोगों को वेट मापने से हमको पता चलता है कि ये ओबेसिटी है या नहीं, बट ऐसा भी हो सकता है कि आपका वेट नॉर्मल हो और फिर भी आपका जो बॉडी फैट है वो सब वेस्ट, मतलब आपके कमर के आसपास हो, तो भी हम उसे बोल वी कॉल दैट पर्सन ओबीज. सो देर आर सर्टन कट ऑफ पॉइंट्स फॉर वेस्ट सर्कम्फ्रेंस, मतलब आपके कमर का जो मेजरमेंट होता है, if it is more than 80 centimeters in women and more than 90 centimeters in men, that person is still called obese even if the weight is normal for the height. So obesity is defined in these two, three different ways, and all of them are important.
बट मैम हमारे यहाँ तो पीपल से दैट यू आर हेल्दी, आप हेल्दी है. सो सच अ लॉट ऑफ सोसाइटियल prejudice on the point कि आप दुबले पतले हो तो you are not healthy. But if
Yeah.
you know you see a chubby child, or you see a person with nice cheeks and good central obesity, you are from an affluent or a wealthy family. That's the notion. How do we
Yes.
fight that?
राइट. सो ऐसा माना जाता है कि अगर आप खाते पीते घर के हो तो आपको अच्छा दिखना चाहिए, यू नीड टू लुक रियली हेल्दी एंड ओवरवेट. बट ये दिस इज नॉट करेक्ट. ये करेक्ट नहीं है, इसलिए कि देखने की बात और, लेकिन अंदर ओबीस पर्सन के अंदर जो मोटापन होता है, उससे जो प्रॉब्लम्स आ जाते हैं जैसे कि डायबिटीज, ब्लड प्रेशर एंड सो मेनी of the other things. So these are the things that make should make a person understand that being overweight is not healthy. Health and weight are not related, in the sense that if you are above the cut point for what your weight should be, then it is not healthy, whatever you may look like.
Thank you, ma'am.
Hi, good evening.
It really needs a. Yes, ma'am. Hi, Dr. Purvi, ma'am. Ma'am is the one who has initiated a lot of RSSDI diabetes bites, and over to you, ma'am.
No, no, not at all. I think this program is for all, and we are so happy that not only the KOLs but also the audience is equally engaged. So, today we have a lot of state chapters logged in, and I'm just going to relay one question from Chhattisgarh, Dr. Arun Kedia, who's a leading physician there and an integral part of the RSSDI state chapter. He has posed some very interesting questions. One is, what should be the dietary pattern in early childhood? Because I think just like osteoporosis, and how we say that it's something that starts in childhood or early mid age. Again, I think obesity and the seeds of it are sown much early on in life. So, some comments on Dr. Neeta on the childhood pattern for, dietary patterns in childhood, and also then how do we keep patients on long term management of obesity?
Yes. Thank you, Dr. Arun Kedia. Both of them are very, very relevant questions. So first things first, and I'm going to answer everything in short so that we can, take more and more questions. So the first question is childhood dietary patterns. So the best way to treat obesity is to prevent obesity. That is what is said. And childhood is the right time to start. So all habits that are inculcated in childhood are the ones that stay on even later on. So, avoidance of junk food and more physical activity and leisure time hobby activities also being more in favor of increased activity. So rather than giving a child a mobile or watching TV, it's nice to go out and play on the ground or anywhere else, or maybe go play badminton or something like that. So if these habits are inculcated, then it goes a long way. Even where food is concerned, avoidance of junk food, avoidance of processed food, giving, even in the tiffin that the child carries to the school, to have healthy food options, that is going to go a long way. Another thing in early childhood is force feeding. So there are mothers who keep complaining to the pediatrician that my child is not eating, and because the child is not eating, all kinds of efforts are made to force feed the child. So that is another practice that should not be encouraged, because the child will eat when the child wants to eat, when the child is hungry. So force feeding is not a good idea. So these are the few things that one can follow to avoid childhood obesity, and in turn avoid obesity in the long term. So the other question that was asked by Dr. Kedia, I think, is how do we keep people into long term obesity management? Am I right, Purvi?
Yes, ma'am.
Yeah. So the question is that uh, the first thing that you have to tell the patient when you embark on treatment of obesity is that it is a chronic disease just like diabetes, needs follow up lifelong just like diabetes. So the diet or the lifestyle modification or anything that you take up to treat obesity and which is successful has to be followed long term, lifelong. So unless that is done, it is not going to succeed at all. The weight is going to come back, just like blood sugar comes back if you stop anti-diabetic medication. In the same way, in obesity, if you stop the efforts that you had put in to lose weight, you are going to get all that weight back on if you stop those efforts. So long-term management of obesity is only long-term efforts, lifelong efforts. And second, long term follow up with the healthcare professional. It has been seen in research very clearly that those patients of obesity, even after losing weight, who continue to do follow up with their healthcare professional, they are the ones who maintain the weight lifelong. If you get lost to follow up, there is every chance that you will relapse.
Thank you, ma'am. There's another question from Dr. Vipul Chawda. People with obesity risk many diseases. Can you explain the health hazards of obesity, please?
Yes, thank you very much, Vipul, for that question. Extremely relevant for our viewers. So, सब समझते हैं कि अगर ओबिसिटी है तो डायबिटीज, ब्लड प्रेशर और हार्ट डिसीज का रिस्क ज़्यादा होता है, और इसके आगे कुछ नहीं. अगर वो हमें नहीं है तो हम ओबीजी अच्छे हैं, हम फिट हैं. तो ये बात सही है कि डायबिटीज़, ब्लड प्रेशर और ये सब चीज़ें ज़्यादा होती है ओबेसिटी में. बट देर आर अदर कॉन्सिक्वेंसेस ऑफ ओबेसिटी जिसके विच पीपल डोंट रियली नो एंड आर नॉट रियली अवेयर ऑफ. नाउ दीज आर द मेटाबॉलिक कॉम्प्लिकेशंस ऑफ ओबेसिटी, जो हमने बताया अभी, कि जैसे कि डायबिटीज़, ब्लड प्रेशर, हार्ट डिसीज़, ये मेटाबॉलिक कॉम्प्लिकेशंस होती हैं ओबेसिटी की. लेकिन ये छोड़ के ओबेसिटी के मैकेनिकल कॉम्प्लिकेशंस भी होते हैं. द sheer excess weight that is there for years and years has a toll on the muscles and bones of the body, and ultimately it can lead to arthritis of the knees. We see so many patients of obesity who have to undergo knee replacement because there is so much wear and tear in the knees that the knees give way and they have to be replaced. That is one part of the problem, that is a mechanical problem. They may not have diabetes, they may not have blood pressure, but they will have these complications where they're not able to move, or backache, constant backache, या फिर बिकॉज ऑफ द एक्सेस वेट रिफ्लक्स डिसीज और एसिडिटी, व्हाट वी कॉल, ये भी एक कॉन्सिक्वेंस होता है. और एल्स कैंसर. Did you know that almost 30% of all cancers are accounted for by obesity? So there's a strong connection between obesity and cancer, and that is also one of the reasons why you need to lose weight. Another problem that can happen is gallbladder stones. In मराठी we say पित्ताशय. पित्ताशयातले खडे जे असतात ते जास्त होतात लठ्ठ लोकांमध्ये. So that is the other thing that can happen. Then one can have something called sleep apnea. Sleep apnea is short spells of reduced oxygen to the brain because of stoppage of breathing when you are asleep. So these are also patients who snore more. You will find that obese people karate jada lete hain, and they can also have short spells of reduced oxygen supply to the brain, which in turn is a risk factor for heart disease. So these are basically, obesity can affect every system in the body. Obesity reduces immunity, so such people are more prone to different kinds of infections. So it is all these problems, not to mention the other consequences of mental health issues. So ओबेसिटी की वजह से डिप्रेशन हो सकता है, एंजाइटी, स्ट्रेस एंड क्लिनिकल डिप्रेशन, सुइसाइडल टेंडेंसीज, ये सब चीज़ें जो होती हैं, दीज आर द मेंटल कॉम्प्लिकेशंस. सो देर आर मेटाबॉलिक कॉम्प्लिकेशंस लाइक diabetes, blood pressure, heart disease, and cancer. There are mechanical complications like arthritis of the knees, sleep apnea, and reduced oxygen to the brain, back problems, reflux disease, acidity, and then there are mental health issues like depression. So it's a wide variety of problems that obesity can lead to.
Thank you, ma'am. That's really sounding very dangerous and overwhelming for somebody to learn that obesity can cause so many diseases. And we were jokingly just discussing amongst our panel in the middle that obesity can cause everything except for pregnancy.
Right.
So that was one thing. We have another question, ma'am, from Dr. Kamal Patil. How to decide a healthy weight for an individual?
Yes. So here, a healthy, thank you so much, Kamal. The way to decide a healthy weight for a person, number one is the classical body mass index. As I said, ideal is 23 to 25, but one cannot always reach ideal body weight. So goals have to be set. 15% weight loss can definitely help in reducing all the metabolic problems, or even 10% weight loss can help. So body mass index is one way of knowing your healthy weight. Second is you can go and check your body fat percentage. So if your body fat percentage in general is more than 25%, then it is more, and one should try to reduce it by a variety of means that are available. Diets are there, different exercises are there. So one is fat percentage, and second is weight for height, that is BMI, that decides your healthy weight.
So, ma'am, in this weight loss simplified session, I think you're simplifying our understanding of obesity as well and weight loss as well. We had another question from Dr. Manohar. Can
Yes.
I request the tech team to please put that question up? Yes, there is much more to obesity than input and output of calories. What's your opinion and how should we approach it?
Thank you, Manohar. Dr. Manohar is a leading diabetologist from Karnataka. So the question he is asked is, there's much more to obesity than calories in and calories out, which is absolutely correct. So there are people who will count their calories and then count the calories that are burned and think that both of them should match. Well, they don't match. They don't match because your metabolic rate, or rather the rate at which you burn calories, and the calories that you accumulate, depends on several factors. It depends on your age, it depends upon your muscle mass, it depends upon your other comorbid conditions. And that is the reason that everybody who does 1 hour of exercise, everybody will not lose 200 calories. So it's not the same thing. Plus, it is also dependent upon whether you have just lost 10 kgs and now you're looking at more weight loss. So it is not calories in, calories out. So your metabolic rate, that is the rate at which you expend calories, is very important. So in general, females burn less calories. At menopause, the metabolic rate goes down drastically. So that is the time that you again cannot lose that much weight for the same work done. Third, if you've lost just 10 kgs, your metabolism is going to slow down. If your muscle mass is low, your metabolic rate is low. So all these things are taken into consideration, and that is the reason that calories in and calories out is never the answer. So, or if you take all these factors into consideration, that is when you customize diet, you customize exercise, you customize goals of weight loss, and only then can you decide what can be the ideal approach for this person. For example, insulin resistance. If somebody has high insulin levels for a given level of glucose and has a high insulin resistance, that person will have to have a different diet. So his calories in and calories out is not the only thing that is done over here. What are his macronutrients? How much of carbohydrate is he taking? How much of fat? So all these are considerations when you are making a diet, and it is not only just a calorie count. If you are doing 800 calories and all those calories are coming only from carbohydrates, then your muscle mass is going to go down, which in the long run is going to reduce your metabolic rate. So it's not just calories. So it is how many calories, where do those calories come from, what is your muscle mass, and how much you're burning. So it has to be customized.
Wow, wow, that's
So
amazing and still mind-boggling. Yes, Purvi ma'am.
So that brings me to Dr. Lotika's question, which is equally important. Uh, what is the role of exercise in the management of obesity? And a follow on to that is from Dr. Arun Kedia, aerobic versus resistance exercise, what's better?
All right. So these are both very interesting questions. Dr. Lotika is a leading diabetologist in South Mumbai, and she has asked this question for the benefit, I'm sure, of all our viewers here. How important is exercise in the management of obesity? Well, I can make a blasphemous statement out here, and I will state, and then I will qualify what I'm saying. And the statement is exercise does not make you lose weight. Well, that is the blasphemous statement. But now let me tell you the corollaries and what I mean by it. Now, exercise by itself does not really make you lose weight if it is not complemented by the right kind of diet. That is number one. Number two is that exercise has different benefits and indirectly affects weight loss and, more importantly, weight maintenance. That is, after you've lost weight, the role of exercise is really very high, and that is when exercise is really very important. So, exercise is an important adjunct to obesity treatment. However, the benefits of exercise are in a very different way. For example, exercise helps to increase your metabolic rate. And that is why I said that exercise helps more in the maintenance phase when your metabolic rate has really gone low. You have dieted, you have done diet, you've done exercise, you've lost 15 kgs, and now you've reached a plateau, and there is a threat that you might regain the weight. That's when exercise really kicks in, and exercise helps you to retain your metabolic rate and helps you to expend those calories, and it prevents weight regain. So exercise is important there. But in the early phase of weight loss, which we call active weight loss period, exercise has a smaller role to play. So, does it mean exercise is not to be done at that time? Not at all. It is to be done, but it is done for its other benefits like fitness, stamina, flexibility. So, these are the things that exercise is going to help you with. And the true exercise, a lot of cardio, etc., that is going to help you, is going to help you in weight maintenance. Coming to the second half of the question, which Dr. Arun Kedia talked about, and that is aerobic exercise better than resistance exercise? Well, it is not either or, it is not one versus the other. They both complement each other, and both need to be done by everybody. So, aerobic exercise, which is like Zumba or walking, running, tennis, badminton, or swimming, these are all aerobic exercises. They are meant to be done by everyone. Typically, according to the guidelines, there should be at least 150 minutes per week, but that is for good health. If you want to actually lose weight and maintain it, it is 300 minutes per week of aerobic exercise. This has to be complemented with strength training, which we call resistance training. And this is extremely important, not only to reduce insulin resistance, to maintain body weight, to build muscle mass so that the metabolic rate increases. So it has umpteen number of benefits, and it is not either or, it is this and that. So aerobic exercise and resistance exercise both are important.
Ma'am, yet another interesting question by Dr. Lakshmi Kaisare. Why people target weight loss more than fat loss?
Right. So people target weight loss more than fat loss because the fat is not seen in the internal body fat is not seen. What is seen from outside is what they want to lose. So that magic number on the weighing scale is all that matters. And added to that is the body not stigmatization, let's say bias. All these things come into the picture and people want to look thin. So this is, just weight loss concentration is a cosmetic issue. Trying to do fat loss is a health issue. Trying to do both is good, both for cosmetic as well as for health reasons. So fat loss has to be done for health reasons, weight loss has to be done for health reasons, and cosmetic issues both are important.
Wow, that's amazing, ma'am. Ma'am, another different sort of a question from Dr. Kavita. Yes, Purvi, ma'am, you wanted to say something.
Yeah, so I think there is one very interesting question, and that's the basic. That's absolutely the basic. How do we motivate patients to lose weight? So that's from Dr. Anil Shinde, and I think that requires. I mean, we would love to hear your thoughts because as a bariatric physician, you probably come across patients who are already motivated to lose weight. But how do we really motivate patients to lose weight? Because these conversations are difficult. They don't even approach the topic. Some tips to all to start with that.
Right. Very interesting question. Dr. Anil Shinde is a diabetologist from Bangalore, and he has asked this question. It's the most important question I feel in obesity treatment. Motivation of for obesity treatment starts with first making the patient aware that you are obese and overweight. Now, there are people who come directly to you and say, we want to lose weight because of this reason. Those are fine, they are already motivated. But the larger chunk of people, they don't know they're overweight, they don't know they're obese, they feel they're fine, and there are people who justify their weight. I've had two deliveries, I have two children, so that's why I'm overweight and this is acceptable. I am older, I'm reaching menopause, so this weight is acceptable. So there are people who justify their excess weight, and so they are not motivated to lose weight. So the first thing that starts is making them aware first that they're overweight, second that this overweight is not okay, this obesity is not okay, and the health problems that they're going to face. So that is what has to be told to them. Now, having said that, what I would say that in my obesity practice I find that the motivation differs by age. So if it is a college going girl, she wants to wear the best pair of jeans and so she wants to lose weight. When a girl is around 22 or 24, she wants to lose weight because she wants to get a good match and wants to get married, or her parents bring her that she needs to get married. When a boy is 22 to 24, ladki ko patana hai, so he also wants to be fit, so that is another thing. And once they get into their 40s and 50s, or maybe even into their 60s, then start the health worries. So they are motivated by health issues. They may already be having one of the consequences of obesity. So you need to make them aware. How to bring this into the conversation? When a patient comes to you and you know that the person is obviously overweight or obese, first assess the readiness of the patient. Where is the patient? Is he even thinking of weight loss? That is called the pre contemplation phase. And if the patient is not even thinking of weight loss, just bring him to the next phase of contemplation. Just tell him the risks. When a person is thinking of weight loss already, I think I need to lose weight, then you ask that person, okay, do you know what are the different ways of weight loss, have you tried anything, and then you slowly build the conversation around that. When a patient is already motivated, then there's no question, you reinforce that motivation, reiterate what he already knows, and then take him forward. So it's a journey. So there is no one size fits all. Everybody is at a different stage of motivation. You just take them to the next step. I can see one question from Miss Kalpana. Can I answer that, Purvi? Yeah. So the question is, Kalpana, she's from Belgaum. So the question is, has diet to be monitored by a professional, as in someone qualified? Absolutely. And that's what we are rooting for, because weight loss is a scientific process. It needs to be a scientific process. Now, if someone has got malnourishment, if someone has got anemia, someone has got vitamin deficiencies, wouldn't you go to someone who is qualified? Wouldn't you go to a healthcare professional? Then why not for obesity? So, obesity is the other end of the spectrum of malnutrition. So, if malnutrition requires a healthcare professional, so does obesity. As I just mentioned to all of you, obesity is a disease. It leads to other diseases, and diseases have to be managed by healthcare professionals, properly qualified healthcare professionals, because the consequences, the treatment have to be as such.
Great answer. I think there's one very important aspect that still needs to be addressed, Dr. Neeta, and I think we all sort of, are faced with this in practice, because the minute there is an overweight or obese person, somebody sitting next to that person will definitely ask, आपको thyroid का problem है क्या? So, is it really true that hypothyroid patients find weight loss difficult? And because they generally, it's an assumption that if you have a thyroid condition, especially hypothyroidism, then you're not going to lose weight, or that's the reason for the weight gain. So, if you can throw some light on the same.
Yes, yes. So there are a lot of people who are hypothyroid and are on treatment, and whose thyroid levels are normal, but they will still tell you that I'm not losing weight क्योंकि मुझे thyroid है. तो ये मुझे thyroid है, ये जो चीज है, it is to my mind, if your thyroid levels are normal and you are using hypothyroidism as an excuse for not losing weight, it truly is an excuse. Because a person who has hypothyroidism is on treatment, has normal levels of thyroid completely, there is no reason why this person cannot lose weight, number one. And this person is as normal as the next person who doesn't have hypothyroidism, because his thyroid levels or her thyroid levels have been taken care of. And this person needs to lose weight in the very same way as a person who doesn't have thyroid. So it's a myth that thyroid patients cannot lose weight. They can lose weight if their thyroid levels are kept in control with the right appropriate dosage of thyroid medication.
Ma'am, one more interesting question was there from Dr. Kavita Rane about processed foods and ultra processed foods, and
Yes.
about yes, ma'am. Can you
Yeah.
throw some light on that?
So, as I always like to say, anything that comes in a packet is a big no no, not only for obesity, but for anybody, even normal people. Eat real food, eat whole food, eat home cooked food. And even if you have to go out, okay, that is fine once in a while. But packaged food is high in salt. It is high in, because of processing, there are certain chemicals that are released. So, it is junk food. So processed, ultra processed food is a big no no, and should not be encouraged at any cost. And it has so many ingredients that are not good for one. So it's not just for obesity, but it can change your gut microbiome. See, there are bacteria in your gut which are good for you, which are living there very peacefully, helping you to digest your food, helping you to increase your immunity. And all this is going to change. Those nice good bacteria that are helping you are going to die off and be replaced by bad bacteria if you eat a lot of processed food. So processed food is not a good idea at all.
Thank you, ma'am. And there are so many questions, but ma'am, I think we'll take one last question from all the comments. And it's really interesting to be hearing so much from you. And it's really been simplified when we are calling this episode as Weight Loss Simplified. Thank you, ma'am. We have Dr. Arun Kedia sir asking, ma'am, can you kindly summarize in brief steps for weight loss or for fat loss?
Uh, yeah. So we consider that weight, if you have the right kind of diet and exercise, then weight loss will also result in fat loss, which is a win-win situation. So if it has to be simplified, there are 4 or 5 different steps for weight loss. Number one is lifestyle modification that includes good diet, good exercise, good sleep, good hydration, and lack of stress, reduction of stress. Please remember, in short, I'm telling you that lifestyle modification has the capacity to make you lose weight only up to the tune of 8 to 10%. There could be some who lose 15 to 20%, but I'm talking on an average. So, if your BMI is so high that your weight loss goal requires you to lose more than 15 to 20% weight loss, only lifestyle modification is not going to be sufficient. You have to go to the next step. And the next step would be medicines or pharmacotherapy. Today, we do have medicines for weight loss, and we should make use of them because weight loss medicines can give you weight loss up to 15 to 20% or even 22%, some of the newer drugs that are coming. There should not be resistance to use weight loss medicines because obesity is a disease just like diabetes. If diet and exercise are not enough, one must not just keep on trying the same thing again and again, change from keto diet to high carb diet, low carb diet, high protein diet, intermittent fasting, keep on trying and not lose enough weight. That is not a good idea. One must graduate to the next step, and which is pharmacotherapy. So there are several drugs today that are available. We have orlistat, we have GLP-1 receptor agonists for diabetes people, we have metformin for PCO, we have metformin. So there are many drugs. They can be used customized based on what the patient has. Then there are people who are very much overweight, whose body mass index may be 35 or 40. And for these people, only pharmacotherapy again is not useful. And these people may have to go for bariatric surgery. So there are expectations and limitations of each modality of treatment. Diet and exercise can help you to a certain extent. Pharmacotherapy can take you further. And even if that is also not useful, in the interest of your good health and your longevity, then you may have to go for bariatric surgery. I urge the public listening into this that seek proper help, seek professional help, because there are people and there are companies or there could be modalities of treatment that could promise you the moon, but trust me, that doesn't work. All diets work as long as they're adhered to, but the limitation of diet is up to 8 to 10%. After that, please go to the next step. Do not resist it because it is in your own interest. Please do not keep on saying that I can manage, I can control, I can reduce on my own. I can do it. I had lost 20 kgs when I was 25 years old, but now if you're 40 years old, you're not going to lose that same weight again. So do not resist. Go to the next step because this is a medical problem. It's not a cosmetic problem. So go to your nearest healthcare professional who is qualified in treating obesity and make sure that you take the right step at the right time before damage occurs. So that I would say in a nutshell is about uh, lifestyle modification. Of course, exercise, sleep, and stress reduction, all of these are extremely important adjuncts in the treatment of it. And behavioral therapy, not to, I mean, that is the most important thing because a lot of obesity treatment is in the mind. uh, Willpower that everyone talks about, or mindful eating, emotional eating, binging, or lack of binging, all these require behavioral therapy. There are people who will give it to you. So you must approach a team that has a multidisciplinary team. Obesity treatment team requires a obesity physician, a nutritionist, maybe sometimes a sleep therapist or a sleep study, stress management individuals, and people who will teach you a lot of behaviors. So all these, so this is all multidisciplinary.
Thank you so much, ma'am. This is an enlightening episode for us. Lightening also and enlightening also, and hope it helps everybody to lighten up a bit. Purvi, ma'am, any closing remarks?
I think this was a unique idea, and Dr. Neeta only suggested this, and I'm extremely thankful because all our state, so many of our state chapter leads have logged in today, and expressed all their questions and their interest in the show. I think this was such an important topic today of weight loss. So people always have any social do also when you go to people have so many questions about weight loss, and this was their chance to hear it from the expert herself. So I think this was a fantastic session, just like Ruby mentioned, enlightening and lightning. So thank you again, and I'm sorry for the poor audio that I am in, poor audio environment.
No, you're fine.
Uh,
We are able to hear you. Yeah.
but thank you so much for doing this, and thank you, Dhruvi, for stepping.
Thank you,
Thank you.
ma'am. My pleasure
Thank you.
to be
Happy
on the
audience.
platform
Yeah.
where both of you are there.
And
Thank you.
I'm really thrilled that we had so many people log in from our different state chapters. Please keep up the momentum. And we are going to come up with new and newer programs and ideas like this. And today we just got a sneak peek into weight loss. And we're going to rope in Dr. Neeta once again
Sure.
for a even more detailed and discussion on the latest information available. So thank you so much once again.
Thank you. Thank you, everyone.
Thank
Bye.
you. Thank you. Thank you, ma'am. Good night. Bye bye. Thank you.